Good day, everyone. Um, I'm excited to be back as promised that we'll be focusing on issues that have public health significance. And today we are going to be looking at one of the top 10 essential or challenges of public health significance according to WHO and CDC. So we are going to be talking about HIV/AIDS today, basically what you need to know, and I'll be presenting in such a way that almost anyone in any field of life can actually understand and make practical applications to their lives and people around them. So, but before we get started on this, I would like to ask, just like a scenario, I just want you to imagine that I'm not wishing you this, that you are just gotten married newly and 3 months after the union, or 2 to 3 months after the union, you had like a repeat test of HIV following the pre-wedding test that you had done, which was negative for you and your spouse. And you find out that one of you actually turned out to be positive. Uh, what will you do? Like, what would be your immediate reaction? What would be your state of mind after 1 or 2 weeks? Is it going to be an end to the relationship and so on? So I just wanted to pause and think around that a bit, and probably also leave comments on what you think you might do uh, if such should probably occur. So, or what advice will you give to somebody who actually passed through that kind of experience? And you know the concept of window period. You can see people actually test window period, that is from the period of infection with the virus to when the person begins to produce antibodies against the virus. Averagely, most people will produce antibody against HIV at 28 days after infection, but generally, we use the 3 month window in which almost everyone is expected to have produced antibody against the HIV virus. So you will notice that when the World's AIDS Day is being marked, that there is usually the use of like red ribbon, and probably you've seen that symbol on so many other things, and you wonder actually what does it mean? Why did they use this? It's actually a group of artists who came together in 1991 and decided to come up with a symbol to show solidarity and support towards people living with HIV/AIDS. And the red ribbon, as stated, is just a connection to the blood and the idea of passion, not anger or violence towards people with HIV. So, quick facts about HIV. I feel that something that have about 32.7 million people all over the world being infected with is something that is actually worth talking about. And according to the NICE report in Nigeria, within like the adult group of people from 15 years to 64 years of life, we have 1.5% prevalence rate. You know what that means in day-to-day use is that you have, for every 1,000 person you see, about 15 of them actually have the HIV infection. This is as of 2008. That's not factoring in new infections, because that was just prevalence and not incidence. So, and the prevalence of HIV among children aged 0 to 14 years is about 0.2%. Again, for every 1,000 you see within that age group, about 2 of them actually have HIV. And among pregnant women, you find out that about 82% of them who actually known their status are actually on ART, or that is the antiretroviral therapy, lifelong drug that is given to people with HIV, leaving the remaining 20% of those children to certain undesirable fates and future. So this is a quick review of the world statistics that actually mentioned 37.9 million people living with HIV, and 2/3 of people living with HIV actually uh, reside in Africa. Yeah, so 79% know their status, is 2% on therapy, and we have a 53% suppression rate. Why do you need to know your status? There is a unique goal for us to be able to achieve epidemic control all over the world. just like almost any other something you can relate to an outbreak or so. For us to be able to achieve epidemic control, 95% of people living with HIV must be identified. And of those 95%, 95% of them should be linked to care and retained in care. Because only those that are linked to care and retained in care can achieve viral suppression, which is the third 95. That is 95% of those that are that have been linked to care should be able to achieve viral suppression. And viral suppression means that when the person is having their viral load done, mostly done at 6 months after start of ART, but with the drug that is being used recently, popularly called TLD, we see a picture of it later so that you can just get familiar with those drugs. Uh, the viral load is done at 3 months because it's been proven to show some level of viral suppression even at 6 weeks on initiation on starting at. So the goal is to achieve viral suppression. The person should be able to see a viral load that is less than 1,000 copies per mil after their viral load test. So this is just like a scenario similar to my introduction, that you just found out your partner is HIV positive. What will you do in these three different scenarios? Just at the start of your relationship, a week before your marriage, and 3 months after your marriage, he or she had initially tested negative during the window period. So HIV and intimate partner violence, this is something that we really need to pay attention to, and you can never eliminate intimate partner violence in without trying to supply adequate information that people might need and find actually relevant. That okay, HIV is not a death sentence. There's something that can be done. It's possible to live. It's possible to live with a positive partner. It's possible to if it's a wife, it's possible to for her to still get pregnant and have a child that's HIV free, including yourself, and so on and so forth. So this is just two different scenarios of expression of love and expression of uh, anger or disappointment. So there's such a concept as PrEP, and that means that to some extent HIV can be prevented. And who are those that can actually benefit from PrEP? Several discordant partners, that is one of the sexual partner is actually positive and the other is negative. So before the positive partner attains an undetectable level, that is a viral load that is less than 40, you might actually want to be on PrEP, and in addition still use like a barrier method of protection like the use of condom. So individuals at high risk of getting infected also with HIV also are people that can benefit from PrEP, like key populations, gay, prisoners, so on, sex workers. Also health workers that find themselves getting more exposed to HIV virus more often. That is, you discover that you need uh, PEP, that is the post-exposure prophylaxis, more often. You might actually want to be on PrEP instead. The difference between the regimen of PrEP, the drug of PrEP, and PEP is just one. If, for example, we said that we use TLD for the treatment of HIV now, for PrEP, we use basically TL, that is the tenofovir and the lamivudine aspect of the drug. And how long should an individual be on PrEP? An individual can be on PrEP as long as the risk factor is present. So elimination of the risk factor is a proof that you can get of PrEP. So um, and a partner is said, an individual is said to be at risk of getting HIV through sexual means if the person have like two or more unprotected sexual intercourse at least within a period of 3 months. Such categories of person also should be on PrEP. So PEP, again, don't just say I be fine if you find out that you know somebody that have been assaulted or somebody that have been exposed to HIV virus or a suspected case of HIV virus in which the status is unknown. Such persons should actually be on PrEP. And PrEP is most effective if received within 72 hours on exposure. So these are the conditions, the situations. Prevention of mother to child transmission. As much as possible, we want to help pregnant mothers who are HIV positive to have HIV free, uh, to produce HIV free generation coming after them, and that is will be practically impossible if we not be able to achieve the concept of U is equal to U. So a mother that is suppressed or a viral load less than 1000 means that that child is actually at a very low risk of getting infected with HIV, and on delivery such children should be given nevirapine. For those that have high that are like we call highly exposed infants, it be a combination of nevirapine and zidovudine. And 6 weeks or at 6 weeks of life or 6 weeks after the use of that particular preventive therapy that is given at birth, do you want to do what is called early infant diagnosis? That is, you want the child to get tested directly by checking for the virus itself and not just the antibodies. Uh, and then to be able to make decisions from there. Again, with concerns and fears about confidentiality, there's such a thing as HIV self-tests. You see, you can just get it from any pharmacy and uh, see your result between 20 to 40 minutes without anyone knowing, within the comfort of your home, and very easy to interpret. This is a positive test that you can see on the right side, and the other one is just a control, like a negative test where you are seeing a single line. Um, Currently, there is no vaccine in use for HIV. There's so many articles and publications online to read about that. And the only thing promising about the ease of use of ART is what is being considered, that is the injectable or the oral cabotegravir. And people are considering uh, too many research work saying that it's going to be an injectable that a positive person will take once a year. Others are of the opinion that okay, the research is towards 2 months, according to different publications and different universities abroad. So, but this is just a drug that is promising that I feel we should just get to know ahead. So, U is equal to U is what we are trying to achieve. Thank you.